Hi, my name is Anat Galor, and I'm a cornea specialist at Bascom Eye Institute. And it is a pleasure to be back in Bogota for the first time in 2 years. And I talked about several topics, including COVID and the eye, because for the past 2 years, all I've thought about is how can COVID show up in the eye. And it turns out that I haven't seen that much COVID in the eye, but from what I have seen, it's mostly showing up as a conjunctivitis and mostly in people who have other symptoms, like respiratory symptoms. But we have seen one case where we recovered virus from the ocular surface in a patient that had no symptoms. But that patient also had adenovirus recovered, so it's not clear what was actually causing his conjunctivitis. We've also seen isolated reports on the connection between COVID-19 and uveitis. Lots of different types of uveitis. The patient I saw had anterior and intermediate uveitis, and COVID-19 and abnormal vascular issues like spontaneous hyphemas in patients with no risk factors. But I only have a few of these, and only a few have been reported in the literature, so I don't know if it's correlation or causation. What I'm really excited about is the possibility that we may be able to detect disease in the eye, and there are some companies looking at this, especially a company looking at using a smartphone to detect the presence of COVID-19 in the eye. I don't know if it's going to work, but if it does, it's pretty cool. So thank you so much for having me here. It's beautiful here in Bogota, and it's a pleasure to be here.